So people come here to acquire knowledge, acquire wealth, and then for those who have money, sophisticated living, they live very well in Accra because all the facilities are there, and then they feel comfortable living in Accra. So we have all the two categories: those who are getting the wealth, the education, and then a good living standards. And there are others who they are here but they can't make ends meet, so they try to survive.
Communities are actually now sitting up because they are seeing people coming down and dying, and even for diseases that have treatment, people don't have money to buy drugs. And this, even if you have, the money is so expensive as it is. Look at our GNP, how many people can really afford those things? It's a poor country.
How healthy do you think I am? Me Madina, me not live. Me area hot because you no as a residential area. Into new site, into MP no hon. While I plan for every Wednesday and Friday, a bracket is me. Yeah, baby, and to hold your hot. Me area they hot.
Me chocolate. See, me say them chocolate. Me can say car hand to. As I say chocolate na me one. Insuo na e wo say na ade no. Niama bebre wo mu asensuo no eye ma e di ba bonten. Afa so kokko timi access ho say de omuja omunai wo ho say na ade say. Na inti say pensuo bia no kana bia to ko sansan so we bia di bia ekọ uni pedua mu a ma ho nto afese chọkọ na e wọ ne sei no obi atumi wu bebre nti efe bi ọkọ akwa na bia ne mba nko atem nti awofo no tumi ma ye duane papa e be di enya ahondin nti de bia so ba ye fe ni efe aye basanti me chọkọ amtinti say Accra ha nto.
The facilities in Accra have been overtaken by sheer population increase, resulting from natural growth and from migration. And then the city authorities themselves are at their wits' end. They really don't know, how to plan the city anymore. We don't even know where to dump the garbage.
A lot of women are going, they keep going even when they're not very well. They would minimize the pains that they're having. They do not pay as much attention to their own health as they do to the health of other family members,
Obviously, you have malaria, but it may well be that you also have, in addition to malaria, anemia. In addition to anemia, you may also have some hypertension.
A good woman does not spend, or a strong woman or a responsible woman does not spend too many days in bed, because then you become a lazy woman.
Women don't do things on their own, generally. They need to get permission from their husband. They need to get permission from, if the husband is not available, from the husband's relation before they can move. And that, of course, limits their access to health facilities.
There are different categories of patients who come here. There are some who are referred from the private midwives, from private clinics, from traditional birth attendants when they have problems in the pregnancy. There's another category who come here out of their own will because they want to come to Kolebu. They claim that if they go to any other clinic, when they have a problem, they'll send them to Kolebu. So why don't they come to Kolebu in the first place? Some also think that by the time they are referred from the clinics and the polyclinics, they may not get transport early enough to get here, and they don't know what may happen to them. There are other category who think that they waste too much time here. There's a long queue, there are too many patients, and they have to wait a long time for them to be seen. So if they have their money, they might as well go to the private clinics or private midwives to be seen. There are others who don't like coming to clinic at all. They would stay in the house and only come when there's a problem.
The whole idea of weighing the child regularly is to be able to identify trends, and if there's a problem, then if the child is not growing very well, it could either be due to the child not receiving adequate food, or the child has a health problem that can be identified and dealt with, so you don't wait till the child is really malnourished before you deal with it. And I don't think we've really done a good job convincing mothers that a well baby clinic is worth attending after you've had all the shots.
One or two.
But now people go here. When you only about 24. On what that I feel not go. They say I find go for label. About what that they say only pain. And next year coffee bar. Not able madam for man for inchim. Not a little to mention. I feel it's a big blade you go channel. Now and I get ya Biden is not sure like a least to say. Then you put on to me now, and they call it police hospital. Wrong. Wow.
Doctors are authoritarian. They do not want patients to, shall I say, they don't want patients to know what is wrong with them. They must tell them what is wrong.
Some feel we shout on them. We are not nice. So such persons won't come to us.
Is it true?
Where does that impression?
Well, it may be true. It may be true in some cases. There may be a little bit of exaggeration here and there, but it's true.
Because some no adults first no to them. But a china was a sign. I'm a sister, I say, you can cry. It's made the book of color when I'm down.
Baby for sign.
Today, clinic.
Because of cash and carry, we previous since 1963, healthcare facilities have been free, to Ghanaians. All of a sudden, the government says, well, we don't have the money anymore, you have to pay. So it's become a problem.
And these days, even at the maternity, women deliver, you said, okay, maybe when they are discharged, they will pay. If they realize that the bill is so high, during visiting hours, a visitor will just carry the baby at the back and step out. And then later, the woman too will just mingle with the visitors and step out. They run away every time.
Doctor, before a person patient, and I say before a show, a person with money bribe the show. One money scadia or show. The guy said with him, Mammy Coconut and property. Now, then the choir no. Oh, you want Gaza with you, Nipanaba. And then I'm there now. Okay. No call, but they were almost say, so one more muscana, a moon show. In every moon, almost 2 was no matter if you do one show.
Mr. went to Medici now. No come charge me dodo. Yet the pen no create me do 5,000. So a debut am ton de amenya sika no kura ndru age of yintina se me pe protection kakra Mary ebeke o me kakra nti nko.
There are so many medical outlets in terms of the drugstores, herbal markets, the churches and what have you. So when somebody is sick, the person sits down and does rational calculation. What is wrong with me? Is it possible I can self-medicate to get this problem over? If I can, why go to hospital?
A few of the pharmacists are working somewhere else. It's the attendants who are in the shop. And therefore, when people go in to tell them that I have, some go with symptoms. So then is this attendant who will then decide that, okay, your symptoms, fit malaria. So they dispense these drugs. But then when they said, okay, a full course, which is about, for an adult, you need 10 tablets. Some will come and say, I don't even have money for 10 tablets. And then they say, okay, so how much money do you have? And then they dispense half dosage.
The chemical seller has to rewrite the prescription, more or less. He has to rewrite the prescription and make sure that the cost of the prescription meets the patient's pocket budget. Blood tannings are very, very important for our healthcare. So many things are associated with blood. So people have become very conscious of the quality of their blood. When you go to the market, blood tonics prevail. And women especially patronize these things. Precisely because, as they argue, every month they lose blood. So they need to replace this blood loss. Of course, that indigenous healers or herbal medicine houses have cashed in on this demand and are doing brisk business. The official policy is that if it's not therapeutic, it shouldn't kill. If it's not therapeutic, it shouldn't kill. So as long as people are drinking and they are not dying, even if it works as a placebo, the psychologically works for them, it's okay.
Edru be na wo ha ni se.
Acho mi ko kwadru. Ko kwadru ansa ko kwala fiwa.
We ye bien.
Woni ye ko kwadru. Eni ye ko kwadru.
Koko ben sa,
koko timi fifiri wani. Ne wani aye kusukusu. Etimi suma wona ase yakese. Etimi fifiri wo ton so. Okay. Ama wuntimi nko tole. Ndi sa wonnuma ye na ejai.
Pacho na uwe dro bi a ase oba anyem na se oba anyem na ohwehwefom onya te se epilepsy
ni na ni subiri no
na ni subiri na ya hoho ni a eno we hefa Pacho no mo friend is saying
friend
Sama Edru. Okay. Na say na no so you see no.
Eno so utimi di bi ya nkwan. Na
one no.
Utimi so di bi sa. Na cha say ni subiri ano.
Na jai.
Typhoid fever. But don't say everything that for herbal clinic. He said, bia o me isu herbal endronro no, enwura endronro no ni enua hoho no de besa o yare no. Eno no ogu ho no ma se ne esifa didi moja mtini nya to aso na na ho beto no. Onya treatment nti esi treat na ache ansa na ogu an ho beto no. Maybe say papa ye herbalist. Na ono nse no se ogu ho no no yare na so ba. At once when our man a dra, no obey some man a dra gradually never yen kakanga go say, no more beton.
except very few, we can cure many diseases. If we found that your disease is beyond our control, we send you to the hospital. Some need operation, and we cannot do it. Like in the herbalist field also, there are people with different gifts. Like people who can cure fractures. When you have a fracture, there's one called Amponchi Clinic at Tema. He is specialized in it. When you have a broken leg or broken hand, and so you just put it and then that goes faster than the hospital. Yeah. When a woman will come, he will not tell you the truth. He will tell you a different thing. Say, oh, I'm having a pile. I'm having some problem. I'm at about 3 months. I haven't seen my period, and so on. Be very careful. Because there are medicines when we give to that woman, within 4 or 5 days, she will menstruate. And if it is pregnancy, then you are charged with abortion. You have to be careful. We don't do abortions here. And the doctor can make a mistake, but he won't tell you. The doctor won't tell you that he has made a mistake. What you want is that he has finished and you went away. But he has spoiled so many things there. The machine, the abdomen there is a machine. And God has made that machine very powerful. But if you destroy it, some of us Christians don't just go and then make some fetish and anything of that. We don't like it. And other people too like it in that way. Yes. Ours are purely scientific way of making it, just like Europeans are also manufacturing theirs. Ours is to learn how to prepare it, how to bottle it, and also to make some research into what kind of diseases is left for us to do. This is what we have to do.
When people go to a traditional healer, they expect medicine. But that depends on whether your condition is diagnosed as physical or spiritual.
We Africans, you see, our setup and then brought up involve us in mainly spiritual things. Not all sickness, not all sickness. The common ones like headache and then stomach problems, they are the normal distance. But the chronic ones, most of them are spiritual.
The worrying thing now is the number that go to churches and spiritualists to seek health care. The numbers are increasing for so many reasons. Maybe they are better at looking at the psychological aspects of things.
There's one lady from La. When she had the eclampsia, when she was convulsing, the relatives ran to the priest in their church to go and inform him, whilst they brought the patient to the hospital anyway. And the priest told them that somebody in the house does not like her. But they explained that she's a young girl. She hasn't got any wealth, any money So who would want to do something to a young girl? Then he told them, then she has to be very careful. But he didn't tell exactly who in the house doesn't like her and therefore has caused the convulsion on her.
I'm going to count 3 and say, I receive my miracle in Jesus' name. Get ready for the touch. 1, 2, get ready. When you hear me say 3, just say, I receive my miracle healing. Holy Spirit, move in this place. I have no power of my own. God, we believe in you that you are a healer. Yes, Lord. At the count of 3. 3! Your confession is what has brought your miracle for you. Receive that touch. Check your body and see if you are still feeling the pain. Check your body. Check your body and see if you are still feeling the pain. Because your confession is what has brought you your healing. Check that place. If it's your stomach, touch it yourself very well and see if you are still feeling pain. Touch it. If you feel that after the prayer, the Lord has touched you, come forward quickly. Quickly. Lord, I seal this miracle in Jesus' name. Come, what was happening to you?
My friend this morning. She don't know what shocking. I received my miracle. You can hear people flashing.
Amen. She said she was having stomach pain. And when I said shout, I received my miracle, there was a flash before her and the pain is gone. Hallelujah. The stomach pain is gone. Can you feel it again? It's gone. No. It's gone.
Yes, ma'am.
Can you run to your seat? Run to your seat. Come, what happened to you?
I was feeling dizzy throughout the day. But as you pray now.
Just now, you received your miracle. Go back. Stand in the Lord. Power of God. Come, what happened to you?
So every form of sickness comes from the devil. When I am sick, I go to the hospital because I believe in medical sciences. But sometimes I just pray because I go to hospital sometimes, I'm given medications, and I still see that I am still not well. So I resort to prayer. I have a good doctor who also sometimes sends patients to me because after he has tried several times, he sees that this thing is not ordinary. There may be something spiritual behind it. So he tells them, go and see Pastor Christie, and I believe that you'll be helped. I also send people to the hospital because there are sicknesses that can be medically treated. Faith works in all angles because if you go to hospital and your doctor gives you medicine and you don't believe that the medicine will work, it won't work. If you don't take the medicine as prescribed, forget about your healing.
We ask that this will be used as a weapon of war. You will fight our financial battles for us. Amen. When I say solid here, I say better life. Solid here. Please come and drop your offering.
People will use herbs, they will use over-the-counter medication, they will go to the hospital, they'll go to prayer camps, etc. I think that women display a lot of agency around that and actively borrow from different traditions.
The whole concept of primary hair care is about freedom to choose, to own your body, to be able to determine what is wrong with you, to demonopolize healthcare. Because doctors have monopolized healthcare for far too long. But medical facilities are colonial institutions or colonial facilities. They have their own ideology. We have accepted the facilities, but seriously, we haven't accepted their underlying principles.
I mean, this is sometimes we look at first aid. Omo to tablet paracetamol, mitumito bebe. Say ankon so a medical ko ebia help us so say ebe kwa na. Na enu nu nyina ntumi na mitumi ko mpae bo so kan.